we have conducted an interesting trial in women with estrogen receptor positive metastatic breast cancer. They received the anti-estrogen medicine letrozole with or without a SRC inhibitor, dasatinib, and it was a positive trial. The dasatinib was beneficial in terms of improving duration of response, but we really had no idea which of the patients would benefit from the dasatinib. And using the phosphoproteome analysis in the clinical trial samples, we found, surprisingly actually, that activation of HER3 protein was a bad prognostic sign. Patients really didn't benefit from the anti-estrogen medicine per se. But interestingly, in those that had the HER3 and they had the dasatinib, they did very, very well, suggesting that HER3 is probably a very important target in metastatic breast cancer. So it may end up defining a way to pick out a group of patients from the beginning of their metastatic journey that are destined not to do well with anti-estrogen medicines alone. They're going to need additional therapies, whether it be dasatinib in a clinical trial, whether it be anti-HER3 antibodies. So I thought that was a very important result. Again, nothing you'd see at the genomic level per se. These are adaptive responses of the cancer to anti-estrogen deprivation that happened in the adjuvant setting. They were on anti-estrogen medicines, their disease recurred, unfortunately. Up comes HER3 in some of them, and it predicts for resistance to endocrine therapy, but there are therapeutic strategies that could be leveraged against that, a number of things. So that's very important. We may be able to assay for that when patients recur with their metastatic breast cancer.